Welcome everyone to our webinar today on the next steps for aged care. Before we begin, I'd like to acknowledge the traditional owners of the lands on which we meet today, wherever our panelists may be. I would also like to pay my respects to elders past, present and future, and any Aboriginal people watching here today, especially those involved in the health sector. Today we'll be hearing presentations from Stephen Duckett, our Health and Aged Care Program Director, and Anika Stobart, Associate in the Health Program, whose latest reports outline a clear path for reforming the aged care system after the Royal Commission. Stephen has held top operational and policy leadership positions in healthcare in Australia and Canada, including as Secretary of what is now the Commonwealth Department of Health. And Anika is an associate in the Health and Aged Care Program at Grattan and has worked on the past 3 aged care reports. So she comes with a wealth of knowledge on this particular topic. So I'm really glad to have them both here today. So we're going to start with Stephen and Anika doing a presentation on aged care for around half an hour. And after that, we'll have plenty of time for questions from the audience. And I've already got some that have been provided by the people when you registered for this panel. But if you have any questions, please use the Q&A feature in the webinar platform to list your questions, and I'll look at them through the presentation. Stephen, Anika, I'll hand over to you now.
Thanks very much, Kat. And Anika, if you can bring up the PowerPoint. So I'd like to start by saying that where I'm sitting at home here is the unceded lands of the Bunurong language group of the Eastern Kulin Nations, and pay my respects to elders past, present and emerging. So as Kat said, we've done a few reports now on aged care. We did 2 reports last year, one which in a sense was a philosophical report, which said basically where aged care is now needs to be totally transformed. We need to totally change the basis of aged care and the basis of regulation of aged care. And so we need to move to what we said was a rights-based approach. And that report is called Rethinking Aged Care. And we were positioning both of those reports to try and influence the Royal Commission and to try and change the debate. And the second report we did, called Reforming Aged Care, took those principles and applied them and said, practically, what should you do? And we thought, yep, we'll try and influence the Royal Commission. And the good news is we did in some places, and some of what the Royal Commission did was pretty close to word for word what we recommended. Sometimes they said, you should just do what Grattan recommended. It actually, those sort of words. And then the Royal Commission came out, and we, as I said, we saw that there was divergence between the 2 commissioners. And as it turns out, I think the divergence isn't great. And it's a pity that they actually didn't reach agreement and have a unified single report. But what we said was, let's step back and say, what should we do? What should government do in the face of this divergence views? And so next slide, please, Anika. We wrote this 3rd report, The Next Steps for Aged Care, and we're going to talk a bit about that today. Next. And so what we're on about was aged care is a big system. We spent about 20 billion on aged care, about 1% of GDP. Incidentally, that's way lower than many other countries do, including countries with similar age profile of us. And there's 1.3 million Australians, older Australians, are in receipt of aged care. Most of the provision is support in the home. Very much of it is 840,000 people are receiving so-called home support. There's a very peculiar, as everybody in this webinar probably knows, we've got multiple aged care programs when we really should have it at one. Anyway, so, a lot of people receiving home support, which is generally low intensity, just these little bits of need that people have. And another 100 or so thousand receive what's called home care packages, 4 home care packages, which count as part of the residential care planning ratios. So between the 2 of them, almost 1 million people receiving home support, older Australians receiving home support. However, the vast bulk of the money goes on residential care. These are much more intense, much more complex people with much more complex needs, much more intense needs. And incidentally, the needs, the level of complexity, the level of support required for residential care has been going up a lot over the last decade. And about 200,000, 250,000 people almost, are in receipt of residential care, but the vast bulk of the money is spent in that area. Incidentally, the proportion of the population in residential care is going down, and going down for every age group. And in no age group does more than half the population in residential care. Now, the sector is divided between not-for-profits, for-profits, and government. We were very careful in our reports not to say for-profit equals bad, not-for-profit equals good. That's not our view, and there's evidence that there's plenty of good for-profit providers and plenty of less so good not-for-profit providers. I should declare an interest here. I'm on the board of a not-for-profit provider, the Brotherhood of St Lawrence. We provide both residential and home care. But you can see that there are a lot of providers and arranged across industry and government, for-profit and not-for-profit. And next slide, please. So what we have argued next is that essentially the aged care system is no longer fit for purpose. So the current framework is regulated by the Aged Care Act of 1997. Australia's needs, the needs of older Australians have evolved, and we've got more and more experience, and the Aged Care Act has been patched up over time. It's got a rationing sort of approach. And over the last year, even drowning out the stories about COVID, we had story after story of poor experiences in aged care, really horrible stories. Also, horrible stories about access. People couldn't get access to home care, waiting 2 years, deteriorating significantly while they're waiting for aged care. So story after story of substandard care and so on next. And so this has created in the community an expectation that there will be change and a willingness to pay for it. There have been surveys that said, we're prepared to face increased taxes to address the problems that we have been so embarrassed about. And so basically the Royal Commission found this rationing approach meant that that the balance of the regulation and policy had been too much on fiscal constraint and not enough about making sure that people get the services they need of the quality they need. Next slide, please. So the Royal Commission, incidentally, a 10-kilo report. There's a big prize if anybody has read every word of it. I went to a webinar, I went to a face-to-face seminar earlier this week where someone got up and said, I've read the whole Royal Commission report. And I thought, it sort of takes you a while. Anyway, so the Royal Commission found many systemic problems across the system, including this insufficient funding, a workforce which is underpaid, not enough of them, resulting in poor care in many, many facilities, ineffective regulation, really hard to actually get the quality. The stories about poor care are an example that there is inadequate regulation, absence of transparency. Money goes into a residential care facility especially, and we don't know how the money is spent. Money should have been spent on care, which is spent on everything else. Consumer-directed care and home care is there's sort of a market-based ideology, but there's no information to help you compare providers. Often no providers in the area where you live, all of which are symptomatic of poor regulation and poor government leadership to actually make sure the system responds to the needs of older Australians. Next slide. So we say in our two previous reports, and again in this third report issued this week, that we need to start again. You can't continue with the existing system. The changes that are required are so great, though, that you shouldn't imagine you're going to be able to do them overnight. The Royal Commission, for example, said, let's get rid of the home care waiting list by the end of this calendar year. Just not possible in terms of either fiscal responsibility or actually recruiting the workforce or actually making sure that the money you invest is actually sensibly invested, not invested into a broken system. So you need to push the reset button to start again and say, let's start with a new Aged Care Act, which actually puts the rights of older Australians right at the centre of the requirement. So the Royal Commissioners said that we should actually make sure we're clear about what we're trying to do and actually write an Aged Care Act which puts the needs of older Australians front and centre. That the system must make sure older people are able to live an active, self-determined, meaningful life in a safe and care environment. So putting the needs of the older Australian right there in the centre, and that is what we should be trying to achieve. There should be a clear purpose, which is about older Australians having their rights respected and implemented. So, as I said, the Royal Commission had its joint report, and each commissioner had their views, and they debated them, and ended up with a bit of differences. There were differences, but that doesn't mean we throw the Royal Commission out. We actually need to use this as a springboard. Millions of dollars were spent on the Royal Commission, and it'd be a tragedy and a travesty of investments if we don't use this opportunity to fix the system rather than patch it up. So we'll first of all talk about the differences between where the commissioners landed. Each commissioner landed differently, and then talk about what we think is the way forward. So Anika, maybe if you start by talking a bit about what each of the two commissioners said.
Thanks, Stephen. So I will divide the explanation of the recommendations up into 4 key groups. Obviously, there were 148 recommendations, so we won't cover everything, but we've touched on 4 key areas where we think that fundamental reform needs to happen, and these reforms will ensure that we can get a better system going forward. So I will start off with talking about reforming the delivery model. So firstly, the big novel recommendation that came out of the Royal Commission was that we should have a new rights-based Aged Care Act, and including part of this is a universal right to needs-based care. So this is saying that we should have older Australians should have a right to care that they need. And so this is a big shift away from the current system, as Stephen was saying, where we don't have rights at the centre of the system, and that this should flow all the way through the design of how care is, how the old Australian should access care and how it's delivered. So they both agreed on this major kind of resetting of what we should think about aged care. So the second point, they said then we should have a new single aged care program. So this includes, rather than having separate programs like we do right now with the residential care, home support, actually putting this all under one umbrella and saying that it should be really a spectrum of support, so that if you want care at home, you can receive the care that you need, low-level care or high-level care. And then if you need to go into residential care, then that's also an easier transition. So it's just one system that you can access with one streamlined assessment process, making it a lot easier, taking away a lot of those barriers that currently exist in getting access to care. And a part of this is also an expanded funding of the care than you can get at home. And under this model, we would see many more Australians actually receiving care at home, which is the preference of the vast majority of people needing care. Another recommendation was that there should be, this is specifically just Commissioner Briggs's recommendation, that there should be a kind of a workforce of personal advisors to older Australians. So particularly when they're trying to access care, they have actually face-to-face support from someone who they can sit down with and work out what kind of care that they want, what services are available in the local area, and negotiating all of that, because currently it's quite difficult. There's an online platform where you have to access and try and get information. It's hard to actually find out what services are available, what the quality of those services are. And so having these care finders is a particularly good innovation in that regard. And then the commissioners both recommended this idea of having care managers. So this is essentially then when you're receiving services in the aged care system, you have a care manager who can help you negotiate all the different services. You might need a whole range of different services, so they'll help you manage all of that and ensure you're also getting access to healthcare that you need and so on. And so they're the kind of main recommendations around the delivery model. And now Stephen will comment on our views on that.
So you can see that there's a lot of agreement there and some nuanced differences. We too think there should be a rights-based approach, but not that the Act should drive the rights-based approach right throughout the system. Now, sure, there's a Charter of Rights now, but it sits on a wall. It doesn't apply before you get into the system. So, yes, we agree with that. We think that the new system should have care planning at the centre. You know, when we talk about needs-based, we're talking about an independent needs assessment. So the rights are qualified in the sense that there is an independent needs assessment process, and that independent needs assessment process should actually drive the funding. That means you don't have this category, home care package 1, 2, 3, 4. You have a much more nuanced approach to identifying and allocating the funding. We support care finders. We think that's a really important addition to the system to help people navigate quite a complex arrangement. We've proposed a system where there be independent local organisations which are involved in all of this, and this regional organisation, local organisation, should actually employ the care finders. And obviously, we also support care managers, but we need independent oversight of the whole system. So we've, in a sense, nuanced in our report what the Royal Commission and the two separate commissioners said.
Great. Thanks, Stephen. All right, next category we have is reforming the governance and accountability model, and this is particularly where we saw more of our divergence between the two commissioners. So firstly, in terms of, they said there needs to be a new overarching governance arrangements for aged care, for policy, administration, quality and prudential regulation. And Commissioner Briggs supports a model where the Department of Health continues to have responsibility for aged care, but it be elevated with the minister at the cabinet level, and there be an independent safety and quality authority. Whereas Commissioner Pagoni recommended a completely independent aged care commission that will be responsible for those governance functions. And looking at this, Briggs particularly emphasised the need for accountability to the minister, and you can see really where the commissioners' backgrounds might play into where they've come to these recommendations. So Commissioner Briggs has a bit more of a background experience as a bureaucrat, and Pagoni comes from a legal background. So I think Commissioner Briggs really, in her part of the report, was really emphasising that a lot of the poor outcomes we've seen in aged care are because of the providers' behaviour, and that actually what we need is better arrangements to oversee providers, whereas Commissioner Pagoni really saw that the government was particularly to blame for why we have such poor outcomes, and that legislation and governance arrangements are really what drive better outcomes. So he thought that there needed to be that level of independence because the Department of Health really hadn't had a good track record on this front. So you can kind of really see that there's a different kind of approach that they come to these questions. But both did agree that there should be a kind of a network of regional offices, or say outposts from Canberra, essentially located across Australia, and to provide a bit more face-to-face support and local planning to the system. But this is mostly just to employ the local care finder workforce. Then they also said that we needed to have better quality standards, and these needed to actually be set independently. And they both suggested that a reformed, this acronym stands for the Australian Commission on Safety and Quality in Healthcare. So a reformed one that includes an aged care function to set independent quality standards. They also recommended there should be an Inspector General of Aged Care. So this is essentially an independent oversight function for the whole system and identifying any systemic problems. And then the Inspector General would provide an annual report to the government that would also be publicly available, something that we don't have in the current system. They also recommended independent pricing. So this is also a novel idea for the aged care system. So having a body that determines the costs of providing care and sets fees and prices. Commissioner Briggs, on one hand, said that this function could just be carried out by the currently existing independent hospital pricing authority and add an aged care arm to that, whereas Commissioner Pagoni recommended that no, this should just be a completely a new body on its own, because aged care pricing is so different to hospital pricing that it needed to be its own thing. Then they also recommended ensuring that there's community representation, a community voice in the system, and that there should be a body made up of people that can advise the government, although they had a different approach on the composition of such a body. Briggs really emphasised that this body that advises government should be made up of older Australians, and called it the Council of Elders, which is a little bit of Lord of the Rings-esque perhaps in its title. And then Commissioner Pagoni recommended more of an aged care advisory council that had much broader representation across the spectrum of health, including people with lived experience, but also providers, people from the workforce and so on. On top of that, on the accountability front, they said that we needed to have expanded quality indicators and star ratings, so a much better system for older Australians to get information about the kind of care and the services that are out there, and be able to really compare the quality of those services and the staffing levels and the outcomes of that, which we don't have in the current system barely at all. And then lastly, they also said that we needed to have much stronger probity regulation, so ensuring that the providers are governed properly and that there's requirements on the provider boards, as well as, I think one of the really important novel recommendations was having a general duty to provide high quality care. So this is actually a civil duty, so that there could be a penalty on a provider if they don't take proactive steps to ensure that the older people they're providing care for are getting high quality care. So now I'll turn to Stephen again, and he'll provide Grattan's perspective.
Thanks, Anika. So if I take the first one first, the new governance arrangements, the critical factor here is that we are trying to drive significant culture change in the provider land and significant culture change in the department. The reason Commissioner Pagoni went with a recommendation for an independent aged care commission is he wanted to ensure that the new approach was totally different from the old, and he thought the department had failed and that it couldn't fix itself. So we said we strongly endorse the need for there to be a significant culture change in the whole system. We strongly endorse that we want to actually signal that the new system is going to be different from the old. But it's a moot point about whether you have to actually establish an independent aged care commission forever to do that. So what we said was that maybe halfway between the two recommendations is to have a transition authority that really manages the transition, repositions the whole aged care system, repositions the regulatory framework, but then you review it after 5 years, 3 years, and then you might fold it back into the department, and that you clearly have it as accountable to the minister, which is what Commissioner Briggs was emphasising. As Anika said, both of the commissioners recommended regional offices. We've said that you must have this regional network of people who can actually have much closer engagement with the services and actually with consumers, much more accessibility and quality, for example, is so difficult to measure, and you want closer engagement to be able to do it. We said the best way of doing that was to have independent local regional organisations. We didn't say who they should be or how they should work and what their composition should be, but basically to have local accountability, that they really get to know their local areas, and you don't have to send everything off to Canberra to make a decision about things. So we really wanted to emphasise that local engagement. As I said, well, I'll skip over those next few, but if you're going to change a body like the Independent Hospital Pricing Authority, you need to make sure they've got the right expertise and so on. But by and large, our recommendations are nuancing and subtle changes to each of them. Thanks.
Great. So thanks, Stephen. We've got the workforce is the next category that I'll talk through. So firstly, both commissioners broadly agreed across the board on the workforce recommendations. So one of the first things they recommended was having a national registration scheme for personal care workers. So currently personal care workers aren't registered, say, for example, like nurses are and doctors are. And as part of this requirement to be registered, they have to have a minimum level of training, proficiency in English, and meet a whole bunch of other requirements. Secondly, they said that we really needed to lift the level of training in the system and ensure that at least a minimum Certificate 3 training of personal care workers, as well as dementia training. Then they said that we needed to have a review of training programs through the Aged Care Services Industry Reference Committee. So this is really touching on the point that although we have about 70% of personal care workers that do have Certificate 3 training currently, a lot of people that are coming out of training and into our aged care facilities, for example, aren't actually showing that they have the competencies to provide good care. And so actually ensuring that these training programs are rigorous and providing good training is really important. The next one is that there needs to be, and this is one of the bigger recommendations and it's been called for a long time, that there be a registered nurse on site 24/7 at all facilities. And I think that should be phased in by 2024, as well as minimum reportable care hours. So about 3.3 hours per resident per day. So this obviously applies to residential care, and that this be adjusted. So if a facility has a lot of high needs people, that they need to then proportionally provide more care hours to reflect that. And as part of these care hours, a proportion of that should be then provided by a registered nurse. A really important factor in the workforce side of the story is wages. We know that our aged care workers are underpaid. I think nurses working in aged care paid 10 to 15% less than those nurses who are working in hospital, for example. So there is a real wage issue here, and it's also important to have good wages to attract more workers into the sector. So the two kind of mechanisms the Royal Commission has recommended, one was to make a submission to the Fair Work Commission to review the award wage, and also that the Independent Pricing Authority that I talked about in the previous slide actually reflect higher or better wages when they make their fee determinations and determine what the cost of care is. Another important one was encouraging providers to employ carers directly rather than using independent contractors. This is something that Briggs touched on, and I think it goes to this point of the casualisation of aged care that we've seen particularly problematic throughout the COVID crisis. And then lastly, they also said we need to have a significant investment in workforce planning. Both the government needs to do this, as well as we need to have this Aged Care Workforce Industry Council involved in having a long-term, both short-term boost now but a long-term vision as well going forward as the population ages. So over to you, Stephen.
So workforce is absolutely critical. The quality of care that is provided is critically determined by the quality of the workforce, and that's the case in healthcare and disability too, for that matter. And so these recommendations are very important. We supported most of those, the same recommendations. I'll just comment on the standards. We wanted to make sure there's the rights-based approach is incorporated in the Cert 3 competencies. Importantly, we heard too many stories when we went around talking about these things about shonky training providers. And so we've got to think about how do you ensure, yes, the training providers have signed off on these competencies. How do you actually, obviously the vocational education quality assurance system is not working well. But so we said one of the ways you can do it is actually have a placement component, and that the employer or in the placement signs off that those competencies can be seen in the person. Really importantly, we are strong advocates of transparency. One aspect of transparency is the star rating system, strongly support that, and also making sure in the financing area that the money that's allocated for care is actually spent on care and can't be spent on Maseratis or whatever, or lease payments or whatever. And so we really want to make sure there's transparency about staffing so that you can address those, people can actually make informed choices. Thanks, Anika.
Great, thanks, Stephen. So the last grouping is looking at the funding and financing model. So they also made sweeping recommendations here to really change how the funding models currently operate. Particularly, they said that we need a new funding model that splits care costs such as nursing from ordinary costs of living, so such as meals and accommodation, whereas this takes it away from the current system where we have a kind of a muddled network of means testing for both components. And so a particular implication of this, splitting the two, is saying that there should be universal funding for care covered by government, just as patients in public hospitals are covered by Medicare. And so this is a consequence of saying, okay, if we're going to have a rights basis and there's going to be an entitlement to high quality care, people, as part of that entitlement, they should be funded for that care that they need. Otherwise, there's a barrier if it's based on their capacity to pay. They also said that in residential care, we must have we can have rental payments, and phase out the refundable accommodation deposits, and that these should also be means tested. And they had a little bit of differing approaches to that. So Commissioner Briggs supported that we should have a capital financing facility so that government can still support if we phase out these refundable accommodation deposits, which usually help residential facilities to invest in capital and renovations and so on, that is still a possibility through this capital financing facility. And Pagoni was a bit unsure about the phase out of the RADs and what it needed for the investigation. One of the really major recommendations here was that in order to pay for all of this, because having, I think, universal aged care model and also just improving the quality of care, we need to be spending much, much more on aged care. And they said a levy. They both agreed that a levy on taxable income is a way to do this, although they had technical differences on how that should work. So Commissioner Briggs said that we should have a Medicare-style levy of 1% of personal income, and that would raise about $8 billion a year. And then Pagoni recommended that actually we should have a hypothecated levy. So that's where the money raised under that levy must be spent on aged care, but this needed further investigation by the Productivity Commission. Over to you, Stephen.
Thanks. So this is obviously a bone of contention. So we supported the split of care funding and not care funding, and the accountability, quite separate accountability. We made some recommendations about the RADs in a separate submission, but I won't go into that because it's highly technical. We haven't come down on the right answer about funding, but we said, look, you should investigate a combination of a Medicare-style levy, which is paid by all taxpayers, whatever age, but also you should look at potential tax funding, which is more paid by older Australians, and that could either be changing the nature of the assets test for pensions so that more of the value of the home is taken into account. That has to be accompanied by a change to the pension loan scheme, obviously, and also potentially changing to the arrangements for tax on superannuation. So, both of those latter ones are more paid by older Australians who more benefit from these changes. Next slide, please. So what should happen? So, the benefit of the Royal Commission is that there's widespread public support for change in the aged care system. Huge amount of change is required. So it is not going to happen overnight. We have to talk about a phasing in of the arrangements. The big debate is phasing in over 3 years or 23 years. Obviously, we'd prefer to have the shorter reasonable time. If we're talking about an extra 7 billion or so, we're talking about 70,000 extra staff or some number like that. And so there's a big workforce challenge in terms of recruiting, training those staff. So it inevitably takes a bit of time. And so we shouldn't have an expectation that everything's going to be done in the next 2 years or even over the forward estimates period. So the first thing to do is there must be a substantive response in the May budget, and the government has committed to that. The leaks that have occurred seem to indicate the government isn't putting in as much money as is going to be required, although it's hard to tell until we actually see the budget papers. Urgent requirement is to expand home care. The difficult challenge for policy in this regard is, do you put extra money into a broken system that the home care arrangements are, the home care package arrangements are now, or do you wait to fix the system, or do you do a bit of both? Put some initial money in right now to actually bring that waiting list down, and at the same time fix it so it works better into the long term. And our view is a bit of both. You need to actually start changing. So basically, you have to write the new Aged Care Act, consult on the new Aged Care Act, change it, and then use that to drive change. And this includes sort of signalling we're going to do changes to registration and training, signalling that we're going to be mandating minimum hours. Some of that might be incorporated into existing accreditation arrangements and so on. And obviously start signalling how this money is going to go in and the expectations about accountability on how this is going to be spent. And some of this can be done by administrative action, and you don't need to wait for the Aged Care Act. And even if you did need to wait, you might change the existing act to actually increase some transparency, and there's been bills in the Parliament to do that in the past. The whole thing has to be driven by this new Aged Care Act. Again, that's going to take 12 months at the least. So you've got to actually make sure that's right and actually introduce one which is solidly rights-based, solidly signalling this is a totally different way of thinking and so on, introducing as part of that new transparency, accountability, star rating and so on, phasing in the regional governance arrangements and clearing the home care waiting list. We think it could be done by July 23. Maybe takes a little bit longer. But then you've also got to step back and say, as we said with our transition authority, step back, how have we gone over the next 5 years? Where are we up to? What needs to be tweaked? Have we fixed all the problems? And so on. Good news is the government has said it's going to respond this in the next month. So wait and see. Now some time for questions. Thank you.
Thank you so much, Stephen and Anika. I think that that's a very thorough presentation, which covers a lot of the things that were being asked in the Q&A, but there's some excellent questions in there. And I've got ones that you've also sent through. So I think this is an interesting one to start with, because I think funding has come up a lot in the Q&A. And the first question I've got for you, maybe Stephen, could a capped help debt-esque loan help finance the cost of aged care, and it's paid for by selling the asset when passing away?
Yeah, so in a sense, that's a different way of doing as I said, one of the options is to increase the pension asset test. And if you do that, you have to change the pensioner loan scheme. And you could do a HEX type loan arrangement as part of that. I think one of the weaknesses of the pension loan scheme at the moment is it's got a significant interest rate, and you really want to make it easy for an older person to be able to borrow and not run out of borrowing if they stay longer in residential aged care. So yes, a HEX type loan arrangement could work, and that's equivalent of a sort of a pension loan scheme.
I'm just curious about that, Stephen. Just as a follow-up question, I mean, just thinking about the sort of people who don't actually own their own assets when it comes to aged care. I mean, how would that affect, say?
It doesn't. So there are two means testing, in a sense, arrangements. There's an income test and an assets test, and they combine in a grid. But if you've got no assets, you actually then have a means test. And many people in residential aged care are of that kind.
Thanks, Stephen. Look, both Kath and Alan have asked a similar question around whether there should be an emphasis on therapies that enable people to stay out of care, and also the emphasis on reablement and rehabilitation in aged care. And I think it boils down to a question about should the focus be on preventative healthcare rather than reactive healthcare?
So is that for me or for you, Anika?
Anika, did you want to take this?
Yeah, I can start off. So firstly, starting from the perspective of thinking about it as a rights-based system. So here we have a system that is actually trying to enhance older Australians' right to dignity, autonomy, and ability to live a meaningful life and maintain their independence. So inherent to that actually means that aged care isn't about just providing basic level support to maintain people's functioning. It's about actually enabling them to live a meaningful life. And so a part of that really crucial is this concept of ensuring that we're having preventative measures as well as enablement in care. And the current system isn't so good at supporting that, particularly at the home care and residential care end. For example, allied health is really important. So physiotherapy, for example, we've seen that only 2% of home care packages provide allied health care. And the Royal Commission has also found that allied health care and residential care is insufficient, and actually that the way that the funding model was designed, the aged care funding instrument, is actually incentivising providers to not necessarily go out of their way and ensure that older Australians receiving care, that they actually improve over time, because the way the funding model works is that if they do improve, they receive less funding. So really important in the way that the new system is designed is the commissioners have put a really strong emphasis on maintaining independence, and so receiving much easier access to allied healthcare, especially in the home as well, and ameliorating any age-related deterioration, and so making it much more accessible in home care. So that's as part of the assessments scheme. They should also include allied health as a key part of that. Needs-based entitlement, but then also really interestingly in residential care, they said there should be an incentive for an enablement approach. So actually that there is a financial incentive for providers to improve the health of people receiving care by using this funding approach again, and not revising if they get better and reducing their funding, but actually maintaining the funding at the same level. And so that there's actually, if they get better, the provider can get a financial gain from that.
Thanks, Anika. And it's a very good argument for why the system needs to be reformed right there. Stephen, one for you, and it's why was the report released with disagreements, which has received much publicity and diminished the Commission's impact?
I was not a fly on the wall in those meetings, but I really think it's disappointing that the two commissioners couldn't have reached agreement. I think there were so many areas of commonality and so much with just tweaking and slight different, hypothecated Medicare levy versus a Medicare levy. It really is disappointing that they weren't able to reach agreement. We also saw in some of the council assisting submissions were slightly different too, but I don't know why they didn't reach agreement, and it is disappointing.
Anika, I'm wondering if you want to take this one. It's how can the states ensure local care providers and employees receive funding versus national lobby groups? Is
that question targeted towards transparency, I'm assuming?
I think it's probably tied into transparency, and that's a good point, because I think Marco has also been asking about kind of fiscal and performance transparency, and whether that should be the first step in implementing these reforms.
Yeah, I think currently there's a real veil of secrecy over the aged care system. The way that even the Aged Care Act is designed, there's provisions that actually don't allow a lot of information to be made public about what's going on. So the Royal Commissioners really emphasised that there needs to be much more transparency about where money is going, and given that a lot of taxpayer money is spent here, we need to be making sure that it's actually spent on care and that it's spent on supporting older Australians to live a meaningful life. So one of the key things that really needs to happen immediately, and hopefully we really see this in the upcoming May budget, is that any new spending must be transparent, and any current spending as well be transparent. And so we need to see that there's a flow through, that money is actually spent on care, and this requires much better oversight of prudential arrangements, so that also they recommended that there be much stronger prudential oversight, so that there's much more public reporting on the finances of aged care providers, and that there's also investigative powers if things are going wrong. And then on the other hand, we also need to be seeing that the outcomes of that. So actually part of that is having this star rating system and minimum care hours and so on, and seeing that we're actually getting these outcomes that we really want to get.
And I think there's been a number of questions as well on, again, the issue of funding. And I think this is a good one for you, Stephen. I mean, you've been through the potential funding options for this model, and you're still investigating those. I think a good question is, how do you offset the intergenerational inequality from a universally funded system?
So that's why we said, the commissioners both landed on a Medicare levy type arrangement, and that is paid by all taxpayers. Now, you could argue that that's reasonable because all taxpayers sometime in their future might actually need residential care or home care or whatever. So, it's in the way that the Australian tax system works, the currently employed pay for the not currently employed, in a sense. So what we also said, though, is when you're looking at the mix of the tax arrangements that you look to pay for this new system, you might actually look to see that some of the answer is taxes which primarily fall on older Australians, either in terms of tax expenditure, that is benefits that reduce their tax, or in terms of the access to other benefits. And so that's why we mentioned both the changing super tax arrangements. So earnings in a super fund, for example, are not taxed at all. So why shouldn't they be taxed at the same rate as income into a super fund is taxed at 15% or whatever? Similarly, the pension assets test. So looking at the incidence of tax so that we actually address some of these intergenerational equity issues that are mentioned.
Now, Anika, I've got a good one for you. This is a question from Anne. It's, what can aged care services do right now to improve this? Oh, sorry, Anika, we've committed the cardinal sin.
I can't believe I did that. Aged care services can do a lot. I mean, I hope they're all keeping their eye on what's been said in the Royal Commission and what the recommendations are. And a lot of things can already be implemented by providers. They can start looking at all the reporting requirements and prepare how they're going to transparently communicate that when those requirements hopefully come in, but also look at ways that they can start in terms of a rights basis, look at the human rights training requirements and thinking about how they can actually build in rights thinking into their service delivery. So this is a really, because this often brings up challenging questions such as how to allow reasonable personal risks and people to do what they want, as well as ensuring that there's safety. And so having those kind of internal questions go on and thinking through really what a rights basis means on the ground is really important.
Just one more for you, Anika, because I know you know the answer to this one. We talked about it on the podcast this week. This one's from Malcolm. What do other countries do about providing care finders, and what can we learn? Is it a uniquely Australian proposal to the model?
Did we talk?
It was just more what other countries are doing similar things, and because I think we talked about Denmark, was it?
Yeah. Okay. Yeah. So I think all countries, I think, have a different approach to aged care. They have very different funding models and transparency requirements. So, like, I think we've talked about how in the US there's the star rating system that we've the commissioners have adopted in their thinking about how to transparently communicate care hours. But then in Scandinavia, and particularly, there's been a whole bunch of research done for the Royal Commission that's really interesting if people want to have a look, that compared different aged care systems across the world. And we were talking about how there's universal coverage for aged care in Denmark and Sweden, I think it was as well. So this isn't an unusual thing. And then some other European countries as well have people there to support people with their enhancement of rights. I don't think they called them care finders. I think they were calling them care advocates. And these people that are really an independent advocate of an older person receiving care that they can reach out to if there's a complaint. They can reach out to that person and trust in them, because the thing about a rights system is that we can't say that it's on the individuals to assert their rights, that if something comes up, they're actually supported, because the power dynamic is not in favour of the individuals in the system here. And so I think having an advocate that you can call at any time if issues arrive or if you need different services, and having this care finder model, I think will hopefully reflect that.
And I think that's a good point too, that the language around that is key to ensuring the dignity and rights of people. It was a similar discussion that's come up in disability circles around the title of carer, whether someone is a carer or does that name actually enable someone to feel dignity about accessing assistance in their life. I think this is a good lead into a question for you, Stephen. And Leah Corbett asks, there appear to be many similarities in the direction of reform with the NDIS. Is there much that can be learnt from disability reform from Grattan's point of view? And have you looked at the NDIS in formulating your report?
A very good question. And yes, we did. So obviously, in a lot of our language and a lot of our recommendations, we drew on the language of the NDIS, including necessary and reasonable and so on language. We also recognise the failures of the NDIS, including centralisation of decision making in Geelong versus Canberra. So that's one of the reasons we went for regional approaches. We also recognise this current debate about the NDIS. We said that we need to address the equity issues to make sure that a person who is assessed by a team in Eastern Melbourne ends up with roughly the same services as the same person assessed by a team in Adelaide or wherever. So we have recommended an approach which involved retrospective comparisons between relative generosity between regions. Some regions might be more generous than average, and some less generous than average. And part of the job of the aged care central system governor, in our case, the Aged Care Transition Authority, would be to actually compare regions to make sure there's similar generosity, compare men and women, compare rural, urban, so you could actually retrospect, not the individual assessment would still be an individual assessment by an independent team and an independent needs-based assessment, but you'd look to see whether on average they're roughly the same. So we did, yes, look at the NDIS, but we think there are weaknesses in the NDIS which we addressed in our recommendations.
We're slowly running out of time, so I just wanted to wrap up today by asking you both what you think the one big ticket item is, so the first item that the government should address, and then also, what changes you'd like to see this year.
So one of the questions in the chat, which I answered typing away there with my slow typing skills, was about what can providers do right now. And I think one of them is this rights-based stuff that we can start to shift where we do, rather than doing things to older Australians, we do things with older Australians and actually try and make sure that what is happening in their own experience reflects their needs and more responds to their needs. And a lot of providers, good providers, are doing that already, that's for sure. But it means actually making sure the staff understand that. Government should be doing the same, sending the signal that this is where the system is going. This, we want the system to shift to a rights-based approach. And that doesn't cost any money, it's language. Second thing is addressing the waiting list for home care. It is short-sighted in the extreme to actually have 100,000 people waiting for the right level of care when they deteriorate, when they're at risk of going into residential aged care. We should be starting the process of getting that done. And those, I think, are really important. And of course, then we have the resi care problems of the stories of poor quality care, the need to improve the staffing, the need to actually have the registered nurse there, and actually starting some transparency about where the money goes, how much staffing each nursing home, residential aged care facility has, and put it up there. And you can do that right now. And you can say, this is an expectation of accreditation. Tell us how many staff you've got on every shift so that people know what's happening.
Anika, anything to add to that?
I agree, absolutely. Stephen said, I think in particular, I'm going to be looking out for the government actually using the rights language in their budget announcement and actually adopting that. I think they've already said that they're developing a new act, but is that new act actually going to be centred on enhancing the rights of older Australians? That's a really important thing that I'm going to be looking out for, as well as I will also add we need to be seeing a much more substantial funding commitment. We are massively underfunding aged care, and this has really contributed to a lot of the problems we have. This has contributed to this extensive waiting list, and it's also squeezed the quality of care. And we need to be seeing carers much more valued and better paid as a consequence. So I think I really want to be seeing big numbers coming up. I think there's already been a bit of a leak that the government is spending $10 billion over the 4 years, but I would like to see $10 billion in the first year. So not quite, but like a lot more investment to really get a better aged care system going forward. That's it.
Thank you so much, Stephen and Anika. And we will be waiting and looking at that budget in detail, especially around health and aged care. And stay tuned because we'll certainly have some events coming up on that. Before you run away, I just want to say that you might not know that Grattan is a non-profit organisation. So we actually give out our research and our events for free, but we actually rely on donations from lovely people like you. So if you feel like you could support our work, or if you've got value from the webinar today, we'd really appreciate if you supported us at grattan.edu.au/donate. Likewise, if you want to keep talking about this particular topic, we'll be putting this video up on our YouTube channel as well. But you can chat to us on social media at Grattan Inst on Twitter and at Grattan Institute on all other social media platforms. Thank you again, Stephen and Anika, for your wonderful insights on this particular topic and your passion for this as well. And thank you so much for coming to our webinar today. We hope you've got a lot out of it. Thank you so much and have a great day.